Hi, and welcome back to In the Hot Seat with Emily Diala and Dr. Viviana Coles. I'm Emily, and this is Dr. Coles.
Hi, guys.
In this series, we are covering issues around different kinds of sexual disorders. So a lot of times people like to say sexual dysfunctions. We don't really love that word because we think it sounds too pathologizing. And, I think we've both found that most of these issues are really treatable. So, so in the last episode, in case you missed it, you may want to go back. We talked about different kinds of female sexual pain. And today we are going to talk about the clinical term, maybe female sexual orgasmic disorder. It used to be known as anorgasmia, but we're going to, we may switch around a little bit, so just follow along.
So one of the definitions is an inability to consistently or ever have been able to orgasm. Mm-hmm. Now, this is the issue. I find that a lot of clients that come in are questioning whether or not they've even had an orgasm before.
Yes, it amazes me. People just aren't sure. And I think one of the big reasons for that is people maybe have seen how an orgasm is depicted in movies or in pornography.
Or described by their friends.
Right, right.
And it's such a personal experience.
Yes.
The other thing about not really knowing is it's for all of you who have had some sort of birth experience, they will, everybody says, when you have your first contraction, you just know. Or when you're in love, you just know. Right. No, you don't know. When it's the first time that you've experienced something, you just don't know.
Right.
So for a lot of women, I think that they either have experienced a mild orgasm or don't know what the sensations are, and it could have been an orgasm, or maybe they're just really, really close and haven't gotten there yet.
Exactly. I think that's the case. A lot of women, when they come into our office and we talk through and we can help them assess whether or not they have or have not had one before. And ultimately what they'll describe is, I feel like I build up, but I don't get that,
sense of
release or, the release of, I don't feel like my roller coaster then goes over the hump. So, so that's where we come in, and it's then to help them figure out how to achieve that.
And there is a lot of information online surrounding female orgasm. If you were to look up or Google Betty Dodson, she's got some wonderful information. She's pretty much devoted her life to the female orgasm. So when you're talking about an O expert, looking online for resources by Betty Dodson, she's got videos, she's got books, she's got all sorts of information that's free and out there for everyone. And she's going to be able to probably help you to pinpoint before you come in to see us whether or not you've experienced an orgasm and if that's something that's possible. But for those of you who just want to come in and talk about it, we can absolutely help you determine if what you've experienced is an orgasm, and if it isn't sufficient or satisfactory, we can certainly give you information on how to up the ante when it comes to your pleasure.
Yeah. So I think it's important to go over some statistics when it comes to the female orgasm. Generally, when we're talking about sex, I really don't like statistics or talking about what's normal or what's expected, because there's always exceptions to the rule, and
we see
those
them all the
exceptions
time.
are perfectly healthy, so. But I think that orgasm is one of those pieces of sex that's just really shrouded in myth and misconception.
Really elusive.
Yes. So a couple of numbers I want to throw out at you guys are that of women who have orgasms, it's only a smaller percentage. The data varies a little bit, but anywhere between 20 to 30% of women can have an orgasm through penetration alone. Okay, that means the majority of women who have orgasms have them through some kind of external clitoral stimulation, right?
Or even nipple stimulation or other erogenous zone stimulation, or a combination of all of them.
A lot of times there's a combination happening for sure. So, I think that's one of the things couples come in with, is they feel like there's something wrong with them if, they can't have an orgasm through penetration. And, I think that's something that is really important to educate you guys about. So, expecting your partner or expecting yourself to have an orgasm through penetration alone.
It's a tall order.
It is. And you know what it's analogous to? Expecting men to have their orgasms through prostate stimulation.
Ooh, I like that. I like that.
Yeah. So, in case you don't know, just Google how to achieve an orgasm through prostate stimulation. There's really only one way.
Yes.
And, probably most guys would prefer to not have their orgasms.
Right,
in that
and
way.
while it's reflexive, it's often also even more elusive than the, than the female desire to orgasm through intercourse alone. Right. Mm-hmm. Now, this is the thing. When you have a partner, and that's all that they're geared towards, that's all that they're thinking, that they think that if we can do that, then we've made it sexually. You spend a lot of time barking up the wrong tree. Yep. Because what affects female orgasm?
Comfort.
Lighting,
I know,
comfort, right? Hormones, how you're feeling about your relationship, how you're feeling about your body, how you're feeling about the food you ate earlier. Mm-hmm. I mean, there's so many different facets to it that to pinpoint your goal as a couple sexually on a female orgasm just seems like you're trying to hit a moving target.
You are absolutely right. I think you couldn't have said it better. It is about hitting a moving target. Mm-hmm. And I think that's important for men to realize that when it comes to female sexuality in general, what worked yesterday might not work today. So that's where communication really comes into play. It is so important to give feedback to your partner. And, you know, women, there are more nerve endings. In fact, there are double the amount of nerve endings on your clitoris than the entire penis combined. Okay, so for both men and women, please remember that, you know, that external stimulation, that's the hot spot, right?
It's definitely the hot spot. And for a lot of people, you can achieve orgasm through clitoral stimulation so much easier than you will ever be able to count on having an internal vaginal orgasm through intercourse. Mm-hmm. If you're a woman and this is something that you're really wanting to find out if you can do, definitely come in and see a sex therapist. We can help you to cover all the bases to figure out what you need to do that. But we are going to cover relational issues because the partner that you're with and what their experience is of the sexual experience really does matter. And the expectations that you have for yourself and the expectations that your partner puts on you is something that we will absolutely try to tease apart to help things get more comfortable, to help you feel like you can put yourself in a sexy headspace to be able to experience pleasure at its max.
Yeah. I think, you know, I remind men too, or, you know, whether you're in a same-sex relationship or whatever, an orgasm is not something you give to another person, okay? Your orgasm is your orgasm to have or not to have. You are in control of it. And part of that is maybe giving feedback to your partner on how they can help you get there. But really, it's about your orgasm. And I think a lot of guys measure their sexual prowess or virility on their ability to, you know, give pleasure to a woman. Mm-hmm. Not that that's not exciting to see a woman who's in pleasure, but really that's coming from her.
That said, if a woman does not orgasm when she's with you, it doesn't have to be indicative of her true feelings about you sexually or about, you know, her expectations for you as a partner. Right. You mentioned something about you being in control. Mm-hmm. And sometimes female orgasm is about losing control, and that can be really scary. Yeah. So a lot of women will talk about how they feel like there's something building and building and building within them, not just emotionally but physically, and then they feel like they're gonna lose control, like literally lose control of maybe some of their body functions. They worry that they're gonna urinate because a lot of the sensations are coming from the same place, so they worry about that, and they hold back. We would have to determine whether or not that could actually happen and what's going on. But most of the time, that is a sensation that's happening in your genitals. Yeah. And so it does make sense to be worried, oh my gosh, I'm going to urinate on my partner, I'm going to urinate on the bed, if I truly let go of my functioning. So talking about that, you'll see a lot of information about that online. And the truth is that most of the time when you prepare your bed for it, go for it. Let go, and who knows if it's going to happen.
Sometimes.
It can be messy and fun and exciting.
And I do want to say one other thing before we sign off, and that is, you know, we've talked about kind of how-tos and expectations with orgasm. I think if we peel back the layer for, you know, what people come in to see us about, if they have deep-seated issues around control or trust or feelings of safety, that's where therapy comes into play, is to help work those deeper issues out. And I think once that happens, most women are able to enjoy an orgasm.
So for more information about this topic, please check out our YouTube videos, check out our Facebook pages, check out our websites. Make sure you hashtag hot seat, that's HOTSEAT, online and on social media with any questions. We'd love to get your comments so that we can comment back and give you some more information.